second material about the district nurse. District nurse is a registered general nurse who manage care within the community, especially trained in community healthcare. This nurse play a pivotal role in the modern day primary healthcare team and are charged with leading teams of community-based nurse and support worker. Who do district nurse are treat? Will a district nurse patient will often be elderly. There is no restriction when it comes to the age of those in need of care. District nurse roles and responsibilities. The roles of district nurse is to provide care to housebound patient by performing regulation home visit. This visit may occur on a day or multiple times depending on the level of care required by a patient. As this visit takes place away from the secure environment of a hospital, it is the duty of a district nurse to perform thorough risk assessment upon every visit, ensuring the safety of both themselves, the patient, and any community-based nurse or support worker who are required in order to treat the client. What is community nurse? Much like a district nurse, a community nurse is a vital coach in the inner workings community's healthcare system. They perform these duties in patient homes or from a healthcare centers. Community nurse roles and responsibilities. A community nurse is responsibilities for performing many of the same duties as a district nurse. This this include basic care, would manage administering injection, setting up intravenous drip, and assisting doctor with examination and medical procedure. So, what is the difference between community and district nurse? As you can see, the differences between community and district nurse are minimal, while in some case, the two roles are near enough identical. In fact, it might even be down to the evaluation of language. The term district nurse was first coined in 1859 when Liverpudlian merchant William Redbone employed a nurse to care for the sick wife. Following the death of this wife, Redbone resigned the service of the nurse so that the people of Liverpool who could not afford to pay for hospital care would benefit from her service in their own homes. After observing the positive effect of this new form of nursing, Redbone, along with Florence Nightingale, worked in tandem to development the service. You can try to present the material based on videos that have been watched by the district nurse, based on videos that have been watched before. And here is the video link of the district nurse that you can watch. Okay, the 10th material is about helping patients with rehabilitation. Rehabilitation nurses are nurses who specialize in helping persons with disabilities and chronic disease achieve optimal heart function and adapt to lifestyle change. The rehabilitation nurse assists the patient in moving toward depends by setting realistic goals and treatment plan. They work as part of a multidisciplinary team and often coordinate patient care and team activities. Rehabilitation nurse can practice in a variety of places including hospital, school, personal training, insurance company, industrial health center, etc. Rehabilitation nurse provide care that help restore and maintain function and prevent complication. They also provide patient and family education, counseling, and case management. The rehabilitation nurse serves as an advocate for patient and families and can also practice in research that help improve rehabilitation practice. Registered nurse who specialize in rehabilitation are often certified by the Rehabilitation Nurse Association. Okay, the 11th material is you can watch the role play video about helping patient with rehabilitation, and you can try the present material beside on the video that has been watched about helping patient with rehabilitation based on the video that has been watched before. And here in the video link helping patient with rehabilitation that you can watch. Okay, the 12th material is about mobilizing patient. Mobilizing, namely the process or activities carried out after surgery, starting from light exercise on the bed to being able to get out of bed, walking to the bedroom and walking out of the room. Mobilization is a major factor in accelerating recovery and preventing post-surgical complications. Mobilization is very important in accelerating the length of stay and reduce the risk of prolonged bed rest such as pressure significance or tension in the muscle throughout the body, impaired blood circulation, respiratory problem, and peristaltic and urinary disorder. Both of these definition can be concluded. The mobilization is in effort to maintain independence as early as possible by guiding the patient to maintain physiological function. Some of the goals of mobilization include can maintain bodily function, improve blood circulation, helping breathing to be better, maintain muscle one, speed up the suture close process, etc. The stage of patient mobilization can be described. There are 7 stages. In implementing early mobilization to prevent injuries, then trained nursing need to provide health education about early mobilization of patient. Factor affecting the mobilization of the post-operation can be carried out immediately among other. 1. Versatile, 2. Disease or trauma process, 3. Culture, 4. Energy level, 5. Age and level development, and then the 6. The role of the family, especially the parents. Okay, you can watch roleplay this video about mobilizing patient, and you can try to practice the procedure of moving patient or mobilizing material patient beside on video that have been watched. And here are the mobilizing patient video links that you can watch. Okay, 13 material is about medical imaging. Technologies who get the best image for the patient to ensure correct diagnosis and also to give them the lowest possible dose for their various tests or procedure for diagnosis. Technologies and sonographies will see patient repeatedly along their path of care. It is the work they do that really drives the decisions that are made regarding patient care, as well as whether the patient is in remission or whether or not the problem is the problem function effectively. By turning to technologies, they are a very important part of this particular process because they are part of the diagnostic and planning process for treatment. Technologies play an important and integral role in ensuring that patients get the best possible care. As not, you can watch a roleplay video about medical imaging, and you can try to present medical imaging material based on videos that have been watched. And here is a medical imaging video link that you can watch. Okay, the 14th material is about diabetes management. Diabetes management required awareness, know what makes your blood sugar level rise and fall, and how to control this day-to-day factor. By Mayo Clinic staff, keeping your blood sugar level within the range recommended by your doctor can be challenging. That's because many things make your blood sugar level change sometimes unexpectedly. Following are some factors that can affect your blood sugar level. Food, healthy eating in concerted of healthy living with or without diabetes. But if you have diabetes, you need to know how food affect your blood sugar level. It's not only the type of food you eat, but also how much you eat and the combination of food types you eat. To exercise. Physical activity is another important part of your diabetes management plan. When you exercise your muscle, use sugar or energy, regular physical activity also help your body use insulin more efficiently. The factors work together to lower your blood sugar level. The more strenuous your workout, the longer the effect lasts. But even light activities such as housework, gardening, or being on your feet for extended periods can improve your blood sugar. 3. Medication. Insulin and other diabetes medication are designed to lower your blood sugar level when diet and exercise alone aren't sufficient for managing diabetes. But the effectiveness of the medication depends on the timing and size of the dose. Medication you take for condition other than diabetes also can affect your blood sugar level. Okay, the last illness. When you are sick, your body produce stress-related hormones that help your body fight the illness. But they also can raise your blood sugar level. Change in your appetite and normal activity also many complication diabetes management. What to do? You can 1. Plan ahead to continue to take your diabetes medication. 3. Stick your diabetes meal plan. Okay, the last material, you can watch the role play video about helping patient with diabetes management, and you can try to present how to treat diabetes patient or helping patient with diabetes management based on the video that was being watched. And here is the video link helping patient with diabetes management that you can watch.